Hi everyone, this is Sonia from Such a Mom, and today I'm going to be talking about gestational hypertension, otherwise known as pregnancy-induced hypertension. Before I get into this video, I just want to remind everyone that I am not a doctor, I am not a medical professional. I apologize if you can hear my dog walking around and barking and being nosy and stuff. His plit-plat is annoying me. I don't know if it's coming through on the mic. So yeah, I'm not a doctor. And what I'm going to share in this video pertains to me and how my doctors are handling my situation. If you have questions or you get different information, please consult your doctor. So first I want to talk about what gestational hypertension or pregnancy-induced hypertension is. There are different kinds of hypertension, and of course, there are different levels. There is chronic hypertension and pregnancy-induced hypertension. Chronic hypertension is hypertension that is diagnosed before 20 weeks or prenatally. Also, you can have chronic hypertension after pregnancy. So if you are diagnosed with pregnancy-induced hypertension and your blood pressure stays elevated after pregnancy, and after postpartum, then you're probably going to get a diagnosis of chronic hypertension. Pregnancy-induced hypertension is usually diagnosed after 20 weeks of pregnancy, and it is caused by pregnancy. They don't know 100% what causes it, but the theory is that it has to do with the placenta. To be diagnosed with pregnancy-induced hypertension, you have to have a blood pressure reading of the systolic number, which is the top number, being 140 or higher, and or the diastolic number being 90 or higher on two separate occasions, at least 4 to 6 hours apart. I was diagnosed with gestational hypertension when I was 25 weeks. I spent 24 hours in the hospital after spending several hours at labor and delivery because my blood pressure was high for about 6 hours straight. It did go down with lots of rest. I rarely got out of bed, and by the next day, my blood pressure had dropped. Gestational hypertension can lead to preeclampsia, not always, and I don't know the statistics, but you are at a higher risk if you have gestational hypertension to end up with preeclampsia. I had preeclampsia with my last pregnancy, plus I am 40 years old. Plus I have gestational hypertension. Those three factors put me at a much higher risk. So during weeks 25 and 26, my blood pressure was quite high. But during week 27, it's actually been really good this week. I get maybe 2 readings a day where my systolic is over 140, and it's not going that far over 140. That makes me feel better. But last week it was really high. And I saw my doctor on Friday, and they told me that they are very concerned I'm going to end up having preeclampsia. They did tell me that they will not let me go past 37 weeks, but they doubt I will even make it to 37 weeks. They even told me to prepare for a very early baby that will need the NICU. That, I think, was based on how high my blood pressure had been last week. I was so fearful and worried about this. However, again, like I said, my blood pressure has been much better this week. So I am taking some comfort in that, and I am hopeful that I won't deliver very early. I think that they were even expecting that I would make it to 27 weeks like I am now, and here I am. They took my urine and they did blood work last Friday, and my numbers were even better than when I was in the hospital. And both times they were fine. Very, very good signs. However, it can change fast, within a day. So I could go from being fine to suddenly having protein in my urine and being in the hospital and having a baby. So they're keeping a very close eye on me. I don't know if they're going to see me every week. I thought they were. So they saw me last Friday, they're seeing me this Friday, and they're seeing me next Wednesday. Next week I'm also having an ultrasound for a growth scan. Gestational hypertension and preeclampsia can affect your baby. So like I said, it is thought that these conditions are caused by the placenta, and having these conditions can affect the blood flow from your placenta to your baby, which can affect your baby's growth. My 1-year-old was born at 36 weeks, 5 days, but he was small. He was only 5 pounds. We left the hospital at 4 pounds, 14 ounces. The week I was induced, they talked about doing growth scans because he was measuring small and they wanted to monitor for intrauterine growth restriction. He was not actually diagnosed with that because that week, like I just said, I was induced. Preeclampsia came on really fast for me last pregnancy. I went from having a couple of high readings in the beginning of the week to having severe features of seeing spots and flashes and lines, having a bad headache, my hands were starting to swell up. I felt very unwell, just not right. I never had protein in my urine and my blood work always looked great. And I guess they're saying that for some people this can happen. Not everyone has symptoms of gestational hypertension. In fact, I think most people do not. I do. Because I have symptoms, they are more worried. My symptoms are very similar to when I had preeclampsia, except I don't have the swelling yet. I do not see anything in my vision. I don't have like loss of vision or stuff like that. When my blood pressure does spike up really high, I get short of breath, I get dizzy, I feel like I'm gonna pass out. My heart starts racing and I have palpitations, and I do get a headache, but the headache does go away, which is a good sign. Apparently, my doctors are very worried that I am getting these symptoms, but again, my blood work and my urine look good. You will notice that a lot of people will be medicated if they have gestational hypertension, depending on how high their blood pressure is and whether or not it can be controlled with rest or whatever. My doctors do not want to medicate me because, of course, medication lowers your blood pressure and helps your symptoms improve. Given that I had preeclampsia without positive blood work, but only positive symptoms, they want me to report my symptoms and be aware of my symptoms. So they basically do not want to medicate me so that it does not mask preeclampsia. When I was initially diagnosed, my doctor told me that if my blood pressure, my systolic went over 150 or my diastolic went over 95, I had to call them and they'd want to see me. I saw them last Friday and now they're saying they're not so much worried about diastolic. I guess they're more worried about systolic in general. And if my systolic hits 160 or higher, I have to go to labor and delivery. They did not give me parameters for diastolic, but upon doing research, it sounds like 110 is the cutoff for, going in and being monitored and stuff. I'm putting this video out there because I did look for other stories and there was not very many available. I looked for other stories so that I could see what people's outcomes were, what kind of numbers they saw, what kind of symptoms they had. I want to share this with you in case it helps you, maybe gives you some relief, comfort, information, support, and I will try to keep you updated. As far as what my numbers have been this past week, like I said, they've been really good. Most of my numbers are actually below the 140 over 90. By midday, I do get spikes into the 140s, but it's rarely above 147, 148, and that I'm pretty comfortable with. I start getting symptoms when I hit about 148 to 150, and that's when I have to lay down. The other day when I was working on baby stuff, getting the baby's room ready and stuff, I started feeling very, very unwell, and I went and checked my blood pressure, and it was 167 over 95. But when I sat down for a good 15 minutes, it lowered down to 150. And then for after a half hour, it lowered down to normal range. I've talked to my doctor about this because being physical activity can raise your blood pressure. And because I have symptoms when my blood pressure starts spiking, like I did the other day, they want me to include those in my logs. Thankfully, it did come down. That was another thing they said, that, they want me to go in if it's above 160, but they meant like a sustained 160 over several hours, and that didn't happen. Like I said, it went down within a half hour. All right, so I'm gonna end this here. I can't tell you how many times that this video has been interrupted. I've had people come in and out of the house. The dog will not stop barking and just being anxious, and ugh. I don't know. Do you guys have a hard time getting these videos out because of all of the interruptions that occur in your house? It is insane. This video is 16 minutes long, but I've been trying to record it for almost 40 minutes. So anyways, I will see you guys next time, and thank you so much for joining me. If this was helpful and you enjoyed it, please give me a thumbs up, and I hope that you subscribe so that you can continue to follow my journey.